Welcome to Almost Here, Round the Corner Future Technology podcasts with Richard Jacobs. Future technologies poised to transform our lives for better or worse are the focus of this podcast. Almost here means these technologies are now here and starting to be used, or just around the corner, from Bitcoin to artificial intelligence, 3D printing, blockchain, virtual reality, and more. Hello, this is Richard Jacobs with the Future Tech and Future Tech Health podcast. My guest today is Sandeep Jain, founder of ListenMD. So Sandeep, thank you for coming. How are you today?
Very good.
Tell me about ListenMD. What's the premise of the company?
Well, as a doctor in practice for more than 20 years, I saw that there is a change in that with medical records and electronics, we are not communicating as patients and doctors with each other and among doctors. So, in the past, we used to write short notes and call each other and collaborate as doctor to doctor, and would spend time with the patients face to face. Now the electronic record is in the way, and we need to set up a new system to communicate in a universal manner across everybody, because different electronic record systems limit the doctors to their organization or their EMR or their hospital. So communication across systems has become impossible.
That's crazy. So I guess, have you seen doctors go in to talk to a patient and they're just looking at a screen and not even addressing the patient? Has it gotten that bad, or what are some of the effects of this?
Yes. So in the doctors have to repeat everything every day. So every time they see a patient, they are supposed to create an electronic record that encapsulates the whole detail, and they get paid for it. And the more they document, the more they get paid. So their interest is always making sure to document. And the doctor who takes his time to do the right thing, call other doctors, talk to the patient for the longest time, has no time to write the best note and doesn't get paid as much as the others. So it's a crisis, I think.
Well, why wouldn't a doctor have a nurse with them, and the nurse is the one, or why wouldn't the doctor, let's say, record the audio of an interaction and then give it to a nurse or a transcriptionist to make all the notes and everything, so the doctor could just focus on the patient solely?
That's happening. They hire PA or nurse or scribes to document, but that gets away from the core information. So what's happening is that the information that needs to be communicated between one doctor to another about a patient is a small fact, which is like important, essential insight, which is basically becomes like a needle in a haystack. So the doctor has to hide his needle of information in a lot of hay, because that's how he makes his own hay, the money, because he has to put it into the billable format. So the needle of information is always hidden in the hay, and the other doctor who has to open his note has to sort through and try to figure out what this doctor is trying to say. So we are always hiding our information in excess information. So what if the doctors shared the needles without the hay? What if they could directly communicate essential insights to each other across systems, across the whole caregiver list of the patient, without having the excess data that the electronic health record requires? So it won't replace the electronic record, but at least important things won't be missed.
So what does ListenMD do? Is it technology to use keyword searches in the electronic health record, or to parse it in some way, or how does it work?
What ListenMD does is provides a platform for communication among all the players involved in a patient's care. So there is a concept of a shared caregiver list, which is controlled by the patient, but everybody can see who is on that. So many times I see a patient who cannot tell me who all his doctors are, when he saw the last set of doctors, when he's seeing which doctor in the future, and how am I going to coordinate his care if I don't even know who the players are? So just by the fact that the patient and all the doctors can have an app that utilizes the same database, that connects in a secure, HIPAA compliant manner all the doctors together. What's happening nowadays is data overload, that the doctors are overwhelmed with data. So the current systems that are provided by the electronic health records and hospitals try to give all the information to everybody, but then everybody does not have it. So what I'm proposing is, as back to the basics, why not everybody know who the other players are in a patient's care, and then essentially communicate with them directly, share packets of information such as a message, a photo, or a short video clip. And of course, the detailed notes and records can follow.
So, what are some of the stumbling blocks to doing this? What do you see?
Excuse me, what did you say?
What do you see as some of the stumbling blocks to accomplishing this and getting it done?
For ListenMD, uh, there is a sense of data overload that doctors have. Doctors are not just doctors, everybody nowadays is overwhelmed with technology. There is a loss of attention span. We are overwhelmed with data and apps and messages and information. So, to ask doctors to use another um, app is a challenge. But I'm having good traction in that, because once doctors realize that this app allows them to message each other essential information without disturbing them, they start using it. And the patients love the fact that they can get all their doctors on the same page. One of the important things on this app is the idea that information is sent at the other doctor's convenience. So what happens is, if a doctor wants to message another doctor, he can send it in an intelligent communication based on the importance of the message and based on what the other doctor wants. In that, the message comes on their time, so there is a delaying of the message intelligently, so that doctors don't feel that they are disturbing each other all the time. So that aspect is very important, because right now every nurse, everyone texts and sends the doctor information all the time. But if that can be managed so that the less important stuff gets all put together and comes at 5 p.m., and the important things show up. What's happening is, there is information overload. So because of that, we are having a fragmentation of attention. Every time a doctor gets disturbed by a message, there is studies show that it can take up to half an hour for him to get back into his previous thinking mode. So we are basically so distracted. So this app is trying to reduce the distraction and yet improve the communication.
I see what you mean. What are some stats that you see? How long is the average time a doctor spends with a patient, and how many distractions come at them during that patient time? What's your estimate?
Well, in my life, I keep my phone on because I'm a critical care doctor as well as a sleep medicine and pulmonary doctor. So there may be critically important messages that have to come. So, uh, if I'm seeing 10 patients in that day, maybe at least two or three patients would get disturbed by some call that comes in the middle about something. Many times it's a text from a nurse, and many times it wasn't necessary right away, but I don't know what is necessary and what was not. So if this app allows that sending nurse or doctor to delay the unimportant message but send the urgent message through, that itself would reduce my distraction.
So, are you implementing ListenMD in your practice? And if so, what are you observing?
I'm using it with my office staff and my doctors who uh, I am in my circle, but it is not yet taken off as to be universally used by every doctor who communicates with me or every nurse who communicates with me. But that would be the goal, that I want it to be used more and more as to where I am, and slowly increase the usage, so all the doctors in my area are communicating through it.
So, how does it work? Let's say, a nurse on your staff gets a message about a patient. What would they normally do, and what do they do differently with the app?
Yes, what's happening right now is that there is something called patient portals. The patients are encouraged to join portals where they can message different doctors, and each doctor they see has a different EMR and they have to remember 10 passwords and 10 different portals, and they message all sorts of important things and unimportant things on the portals. And the doctors and their offices on the other side are totally overwhelmed by these messages that they cannot handle. There's so much volume that comes that the important questions and the unimportant questions are all mixed together. So there is a reluctance among some doctors, in fact, to even allow patients to use this portal messaging system because it's so open. The patient can say anything at all, and then they might have to respond to it. So ListenMD allows the patient to load the app called ListenMD. The doctor loads the app called ListenMD Doctor, and so does his staff. So it allows messaging on a universal page in the doctor's office in terms of home messaging. So if the patient says, and the patient limits messaging to alerts. So patient has knock knock, I am emergency, I have sickness, I am requiring appointment, I need medication refill. So he has pre-selected ways of alerting the doctor's office, and then the doctor office can open the window and say, yes, what's the matter, you said you are sick, and let's discuss. And that is messaging done right away without waiting for the portal to open, and yet is more responsive, and it triages the type of messaging properly. So in my office, the situation has totally changed now. Patients can call knock knock, I am sick type of message. My office staff responds to them and say, what's the matter? And then they message me on the app asking, can he have some antibiotic? And I say, have the antibiotic. And they say, take the antibiotic to the patient on it itself. And then a month later, when I see the patient, that messaging stream is copied and pasted into the electronic record for me to use. So it improves my documentation and makes my understanding of what happened to the patient in the last month so much more accurate.
So what has it done to the volume of messages you get? Has it reduced it, or has it how has it changed your workday?
Um, we're still trying to use it among all the patients. So among the patients that I'm using it with, it has had a great benefit because I am able to communicate about patients utilizing snippets of information. So there was a patient who had a problem with the uh, echo. So I could take a video, a 10-second clip of just the important part of the mitral valve, which seemed to be wrong, and then I could send that short video to the cardiologist, and he said immediately, yes, this is something important. Or I could send X-rays to the other doctor about how his X-ray looks much worse. The most useful thing for me has been the lack of stress, because as a lung specialist, I see patients who have something we call lung nodules, spots on the lung that could turn out to be cancer. So in the past, it was such a stressful thing that you might forget to follow up on it, and then it will become cancer and it will be too late. But now I take a photo of the nodule as I put the CD into my computer, and then it's with me all the time. I show that to the patient, and then I put an alarm on my app. 6 months later, alarm to me, alarm to the patient, alarm to my office staff. Nobody can forget. The patient will never have a situation where he goes too long and it turns up into a large cancer without anybody finding out. So the lack of stress is what I find nowadays.
That's great. Yeah. Huh. Do you feel like you have more time with patients, or do you have more time in your day, or is just a lower stress level?
So the reduced stress of not forgetting anything, because then can set my alarms. As I round on the patients, I can send my billing information to my biller, so there is a improved revenue that way. But the ability, and I can stratify. I can choose which patients I allow um, to pull my chain, so to say. Right? I mean, most patients I allow. Okay, you can send me an emergency alert all the time, but some patients who I think may not need it or who may be misusing it, I sort of just say, okay, you only have an appointment alert, and uh, I don't allow them to sort of alarm me all the time. So the ability to know that your favorite patients can call you at any time is useful to me. But every doctor may not be the same. Some doctors don't want anybody to call, but then they can use that their setting like that. Those doctors will have their office open up the message. But on the office side, the staff members still benefit from the stratification of the messaging, because the messaging being appointment, sickness, emergencies, and medication refills come up in different buckets, so to say. So then, if right now a doctor was getting 30 messages or the office was getting 30 messages, they would call all 30 of them to find out which one was the important one. Here in the morning, when my office comes up, they know which are the two patients who were really sick, who needed appointment, and who needed something else. So, and the messaging among offices is useful, because sending the PDFs between one doctor to the other is always a problem, because the EMRs are not sharing the data. So one doctor's office and another doctor's office uh, are always having this game of this fax machine. But among the offices who are using the app, we are able to share the PDFs easily on that patient's page, so that everybody knows what's going on. So if Dr. A um, consults Dr. B, and their office sends the records over to Dr. B, next morning, while the two doctors meet in the hospital, Dr. B can pull up that PDF. So the connection between office to hospital and between the offices becomes very important. And when we discharge patients, we give them appointments right away. So I just made this app for myself. So of course I would love it. So other doctors are loving it. It has something for everybody. And the patients love it because they know that they can have all their doctors in one screen, and all the appointments in one screen, and all the reminders of their appointments. And then they know that they can share that data of when, which doctor they are seeing when, with all their other doctors. So South Florida, where I am, is very fragmented. There is a Cleveland Clinic, there is Memorial, Broward General, different hospitals that use different EMRs. One uses Cerner, one uses Meditech, one uses Epic, and they don't talk to each other. And even if they did talk, there would be too much data flowing around. But the ability for the patient to um, put all their doctors in one app, and then decide which doctors they want to share with everybody, and then when they go to a doctor who's across into another system, those doctors can easily communicate with the other doctors. So it helps the patient, in that a patient who has doctors in Cleveland Clinic um, and in Plantation, where I am, can communicate among each other, with, because even though they are on different systems.
Um, why is this not a problem with the current EMR and HIPAA system? Why is your app allowed to function and share this data when the EMR doesn't, or can't, or won't?
Well, it's medical information is subject to a lot of sharing rules. There is Health Information Portability Act called HIPAA. I had to be very careful when I built this system to follow all the rules regarding HIPAA. The fact that we are sharing only the information about the caregiver, getting consents at each step, and using a shared database which matches the patients together, so that if one doctor loads 5,000 patients, second doctor loads 5,000 patients, and the third doctor loads those patients, the system will match that patient with its name, date of birth, and other information. So that took a lot of work to make a system that can match things together. Now, there is something called Health Information Exchange. There is something that is happening. So I do think in 5 years, um, a doctor could pull up a patient on any system he's on and go into the data of that patient in other hospitals. But but that's far away. There hasn't been the sharing of data seamlessly that should have happened long ago. Like when medical records were made electronic, the idea was that people would share them, but then it was very fragmented. There were different companies and different systems, and the interest of those companies and systems is to um, limit the sharing. Um, the government is trying to make them open up, but it is taking time. So ListenMD is a solution for now, um, and I think for the future too, because even if I was to have all possible information on a patient, do I really have the time to go into the five hospital systems he went to in the last year, and to the five different doctors' offices he went to, and wade into their data streams and collect all the information myself? Isn't it simpler for me to know who the doctors are and quickly message them and say, hey, what was the pathology? What was that blood test? Did he really have the rheumatoid disease? So I can ask selected information. So if we doctors are able to curate the information and present it to each other in a more succinct manner, we save each other's sanity and time.
So what's next for ListenMD? How's it going to be evolving over the next 6 months or a year?
It's work in progress. We have added telemedicine, so I can do video telemedicine with the patients. And as medicine moves towards um, a population health uh, basis, when you move towards quality of care, then using something that improves communication will become more important. There are accountable care organizations that benefit by reducing the cost that Medicare spends for each patient. So, right now, doctors unfortunately haven't had the incentive to do this type of communication because, okay, you got sick, go to hospital, I'll see you there and charge you again. But if I'm going to be paid as a doctor to take care of the patient's health, and if by calling him at midnight and preventing that admission saves me money, I would do that. So I think the economics of the system are changing, the way the payments are changing. So this type of communication system is essential moving forward, both for quality of care, but in how the economics of the system is, that too. And the telemedicine will become very important because it no longer will be important to ask the patient to come back and say, okay, I will tell you your lab results when you come to see me again. I would share the lab results with you on the phone. I would send the results to you through my app to your app. I would document in my app that I talked to you, and maybe on video too. And that's all we were discussing, lab results. So why does the patient have to come and see me again and have his blood pressure measured? But right now the economics dictate that the patient come back and get that done. But in the future, that is going to change. So uh, that's why I think ListenMD is very timely.
Makes sense. Okay. And then the patients themselves, have they given you good feedback? Like, what's their perception in your practice?
Oh my God, they love it. Just today, I saw a patient in my free clinic. The health system I have runs a indigent clinic, and the patient came in, and the niece was there, and she was having a folder like 6 inches thick with all the records and notes about the patient going to this hospital and that hospital, and she was so organized. I was quite amazed. So when I said, "Oh my God, I'm going to show you my app," so I had her download the app for the patient, and then she saw that you can keep all the doctors' names in it, and my app on the on the patient side even has a place where you can attach documents, so you can attach a PDF or take a snapshot of the portal she goes to for a patient and with some lab. So all these stuff that we want patients to save, they can save in their app, and then they can slide and send it over to us. So why not make the patient a partner in the care that we give to them? The patient is the one
Yeah, makes
who
sense.
can go to different portals, uh, and we can tell the patient, get labs from there, get this from there, get your X-ray report from there. They will put that into their app, and they can slide and send as messages to me, where then I can copy and save it in my EMR.
Makes sense. Very good. So, what's the best way for people to get in touch and maybe to use ListenMD in their practice, or to find? I don't know if you have a list of doctors that are using it. I mean, I probably would prefer to go to a doctor that has this versus not. So, what are some resources for listeners?
Well, of course, ListenMD is available on the App Store and Google Play, and as of now, anybody can load it. When they choose add a doctor, if they put the phone number of the office of a doctor who already is using ListenMD, it will populate and they can connect right away. But if not, they can put the doctor's name by hand and the information by hand and put their own appointment time by hand, and then it becomes an alarm clock. So if a patient had 10 doctors and they are all in California and nobody's using the app, that's okay. They still get to know who their doctors are on one page. They get to have reminders of when to see the doctor the day before and 2 hours before. And by chance, if some doctor starts using the app, that doctor will now see what the appointment times of the other 9 doctors are. And as the second doctor uses the app, he can communicate with the first doctor. So I want it to grow from both the patient side and the doctor side. So patients load the app independently and can use it to organize their information. And among doctors, any doctor can load the app, but they have to load a different app, Listen MD Doctor, and then they can push the button called Try Listen MD, and that allows me to activate their free trial. And the messaging between doctor and to doctor is always going to be free, because that's the whole idea, that you want every doctor anywhere in the country to communicate with any doctor anywhere else, across systems, across EMRs, no matter what. But then if there are other services they want, where they want bulk uploads of all their patients, they want to do video telemedicine, they want to have their office staff organize information, do research. So different practices have different needs, and uh, then I'm still working on making the best business model for it. But for now, of course, as you know, for apps, growth first, money later.
All right, well, very good. Well, Sandeep, I really appreciate this. This is a great thing you're doing, and I appreciate you coming on the podcast and telling people about it.
Very good. Thank you for having me on this podcast.
You have been listening to Almost Here, Around the Corner Future Technology podcast with Richard Jacobs. Subscribe to this podcast, post a review to discover more future technologies that are poised to transform our lives for better or worse, such as Bitcoin, artificial intelligence, 3D printing, blockchain, virtual reality, and more.